Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Ryan back here with us today for his 5th session, right?
Yes, sir.
In your left shoulder rotator cuff tear repair surgically. So we're rehabbing his left shoulder in the beginning stages of your month post-surgery now?
Yes, sir.
Okay, so we're going to take a look at him in the mirror here and show you how we're doing this. Okay, let's have you flex your head forward and then backwards for me. Your posture is actually looking better than it's looked in months. I think that's probably because you've been coming in a little bit more often with your shoulder stuff.
Yes, sir.
I want to do a shout out to a very dear friend of mine and colleague up in Albion, Illinois, Dr. Mark Garrison, who just wrote a book that's on Amazon now. It's really good. I just got it this morning on Audible. It's about, he was a Vietnam helicopter pilot in 69, 70. Some of the worst fighting up there. He was a medevac helicopter pilot as well as being in the 7th Cav, so he saw a lot of action and made it back alive and became a chiropractor. So Merry Christmas and Happy New Year, Mark. And this will be our last day in the office until January the 5th. So if you want to contact us, use our website to do that, advancedchiropractic.com. Got one more here. There we go. Okay. Whew. It takes a lot of my strength to adjust Ryan. He gets me going first thing in the mornings. Okay, let me have you tilt right for me. Will you let me go? Okay. Now, let me have you go. That's better. Okay, that's the best. The left side's moving in a while. Yeah, it was. You're trying to hit this bill. I can't fight you, you're too big. Okay, sorry about that. I bet you on your left shoulder. Okay, let's come over here. I'm going to tell you. You're patting on your left shoulder. You can see he's still favoring his left shoulder a little bit, but he's actually been without a sling now for what, about a week?
Yes.
And so we're getting his elbows straightened out. His left leg's still coming up a little bit short here, so his pelvis still needs to be adjusted. Here in the left hip side joint. There we go. And the right hip side joint. This is the Z-axis and the X-axis, and then the sacrum, straight superior to inferior in the Y-axis. L5 is straight P to A in the Z-axis. There, L4, L3, that was probably the sorest one. There, and there's L2. Okay, I'm going to put your head down a little bit so it ease up right there. There we go. Good. Don't think about me. There you go. Good. Better. Think about Santa Claus. Or Mrs. Claus, or whoever you want. Okay. So now they're even though, and this should feel a little easier for you this time, Ryan. They stay even.
Yes, sir.
Good. Okay. We'll pull the Carbonator out here first. Ryan's got some really large muscles, so for me to get down deep into those tissues It really takes my elbow or the Carbonator and Ryan handles the Carbonator pretty well, but it still is a pretty big pucker factor. Okay, so now we're going to get the high frequency rapid release technology Pro 2 out on him and work on his paraspinal musculature as well as his shoulders. We start off with the large head and it's more diffuse. And we run that right along his paraspinals. You probably feel it right here in this thoracolumbar area. More so on the left. It's a lot better than the Carbonator though, huh? Yeah, you don't pucker near as bad using this one as you do the Carbonator. Very few men that can handle the Carbonator like you do though, Ryan. By the way, men are usually the biggest wimps when it comes to using that. Oh, everybody's wanting to know how tall you are, Ryan. 6'3". He's 6'3", and I'm barely 6 foot, so... Takes a little extra leverage working on Ryan. I'm going to go ahead and work on his teres major and teres minor over here in his scapular region, which is the left shoulder blade itself. That's sore right there, huh? Oh, okay, okay. Okay, I'm going to use a little bit more pointy on it now. Ooh, yeah. Light it up. Yep. And now we're going to use this more pointed end on the rapid release to work on his traps, levator scapula right here, and rhomboids right between the shoulder blades. You're probably going to feel this too. You can always tell when you get over a hot spot on someone, and that might be a trigger point, or it might be just a tender nodule, muscle hypertonicity, or increased tonus due to misalignment or subluxation of the vertebrae, or injury to the muscle. Right through there. Okay, Ryan, let's go ahead and have you sit up for this next part. And take your shirt off and face towards me for me, please, sir. And again, we're still in the phase of rehab where I'm going to be moving his left shoulder passively while we're using the rapid release technology. And we do this very slowly. First thing I wanted to do is get total extension out of his elbow, because when he was wearing the sling, 2 weeks before I saw him? When he came in here, he basically can't move your elbow or arm except for what it was like in the sling, huh? Right. You come in here with the elbow up in a sling, it's going to stay that way because the collagen that's being laid down inside the body to form new tissue, which is always constantly being formed, by the way, becomes adapted to that exact range of motion. And if there is no range of motion, that's what it locks in on, and it holds you there. So it's really important to get started in rehabilitation early on and do it passively initially, and then active, which is where the patient's moving their own joint, whether that be your shoulder, your wrist, or your spine, or anywhere, knees, anywhere. Work on here. Anterior delt here, and then superior deltoid, right over the incisions here on the AC joint. And I'm not putting any pressure on this Pro 2, I'm just actually barely touching the skin with it. But I'm gonna put this down for a second so I can get it different. There we go. This is a pretty good workout for me first thing in the morning, just lifting up Ryan's arm. This is probably the maximum range of motion we've had today. Here. Where are you feeling this mostly? Right here? Or back in the trap one? So while I'm doing this, and I'm actually increasing his range of motion beyond what we have so far, 2 days, this being his 5th session, we're going to use the rapid release right on that trap where I'm lifting up his shoulder a little bit more. And we've almost got full abduction in your shoulder now. Has any of that pain calmed down yet?
Actually, yes, sir.
Okay, good. And they can't get too close with the camera because this high frequency actually disrupts the video. I heard a couple of you mention you thought you were watching on mushrooms the other day. I don't know what that'd be like, but...
Oh.
So I'm going to let it down slowly. We still want to keep his elbow extended. Work on that tricep muscle right here. And even the bicep, because the bicep starts drawing up a little bit when your arm's curled forward. So you want to make sure get all these muscles working together for his entire functionality and range of motion in his left shoulder. And then even the pec muscles here. This is pec major right now. Let me get in here a little bit more. Pec minor, it's probably a little sore right in through here. Right there especially. The anterior delt right there. You can follow the deltoid all the way around. And you can see we're letting his arm down slowly and through a very controlled range of motion. And you can see he's leaning a little bit to the right there. So that's just compensation, but we want to continue to encourage everyone to keep their heads and chins up and back and their shoulders pulled back. Yep, like that right there. Which is optimal posture, because when you have forward head posture, it puts increased stress in your traps, your levator, scapula, and rhomboid muscles. And that'll slow down the healing process. The left side of his neck's been really tight since we've been doing this, and since he's had the surgery, but it moved better today than it's moved the whole last time, 4 visits, so. This is a very first time that, as far as I'm aware, that a case study has been done using video documentation to show a post-surgical rehabilitation of a left shoulder rotator cuff tear injury. And that's where the rotator cuff separates from the bone completely. It's called a grade 3 tear. There's a grade 1 tear, which is a sprain. Grade 2 tear, which is also a sprain, but it's more severe than grade 1. But it's not totally detached from the bone itself. And then you get a grade 3 tear, which is totally detached from the bone off, and pull some of that bone off with it, creating a spur. And that's what you had in there, right?
Yes, sir.
Okay. So, would you mind just moving your shoulder on your own and seeing how that feels compared to when you walked in this morning?
It's definitely loosened up.
Yeah, see, he's getting some circumduction in his shoulders right now. One thing I'd encourage you to do, straighten your elbow out a little bit more when you're moving it to see how that kind of puts a little additional stress on it.
Yes, sir.
But we want to stress the tissues. You do want to stress muscles and ligaments, tissues following the injury or rehab through controlled ranges of motion. First passively, then actively, and then eventually we're going to have him doing some active resistive stuff too. But Ryan, this is your 5th session. What would you tell our YouTube subscribers and viewers about how you've done so far?
It's less pain every day.
And,
less pain every day and more movement.
Yeah. And would you consider this as an effective rehabilitation methodology as opposed to physical therapy?
Yes, sir.
Okay.
Absolutely.
Great. Thank you for sharing your story with us. And come on over here and we'll shoot you now.
You gotta pull his legs.
Oh, yeah, I got to pull your leg too. Can't get out of here without me pulling your leg and shooting you. Thank God for Renee. Yeah, Advanced Chiropractic Relief wouldn't be what it is without Renee. She's the best half of me. I'm trying to get points before we go to St. Paul. Yeah. Okay then. There we go. That was a good one. Feel that in your knee and your back?
I did, sir.
Good. Okay. There we go. That's it. Better on that one. Okay. Okay, let's have a look here now. That looks good already. Not a little kinked right there, but let's kind of pull these up and back a little easy now. And I'm going to bring you back just a little bit, lift your chin all the way up to the ceiling. Okay, now let's try that same thing one more time. Normal range of motion, posture is 3-dimensionally perfect in the X, Y, and Z axes right now. How's that feel, Ryan? Perfect. Good. Good man. Well, this is your Houston chiropractor, Dr. Gregory Johnson from Advanced Chiropractic Relief in Houston, Texas with Ryan. Merry Christmas to you, Ryan. Happy New Year.
You too.
It's been my pleasure and Renee's pleasure all year long. We'll see you next time.